Question number 13. What is the urinary bladder and what is its function in the urinary system? It is the part of the kidney responsible for filtering the blood. B. It is an organ that produces urine. C. It is a tube that connects the kidneys to the bladder. D. It's a hollow organ that stores urine until urination. Pause the video to answer. But if you just want the result, in this question we have the true statement D. Now let's make an in-depth comment on the question. The urinary bladder does indeed play a fundamental role in the urinary system by storing urine until the moment of urination. Let's explore its characteristics and functions in more depth. Anatomy of the urinary bladder. Location. The urinary bladder is located in the lower pelvis. Behind the pubis. It is a hollow muscular organ, shaped like a balloon, which expands as it fills with urine. Capacity. The capacity of the bladder varies from person to person, but generally you can store between 350 and 700 milliliters of urine before you feel the need to urinate. Layers. The bladder has 3 layers. Mucosal layer, internal, lined with epithelial cells that protect the bladder against infection and facilitate urine storage. Muscular layer, made up of 2 layers of smooth muscle, responsible for contracting and expanding the bladder during urination. Adventitial layer, external layer surrounding the bladder, containing blood vessels and nerves. Function of the urinary bladder. Urine storage. The bladder's main function is to store the urine produced by urinating until it is convenient for the body to eliminate it. Urine flows from the kidneys to the bladder via the ureters. Control of urination. The bladder works together with the nervous system to control urination. When the bladder fills up, stretch receptors in the bladder wall send signals to the nervous system, generating the sensation of needing to urinate. Elimination of urine. During urination, the bladder muscles contract, while the urethral sphincter relaxes, allowing urine to be eliminated from the body through the urethra. Factors that influence the control of urination. Amount of urine. The amount of urine in the bladder is the main factor influencing the need to urinate. Medical conditions. Certain medical conditions such as urinary tract infection, bladder overactivity, or neurological problems can affect urination control. Medicines. Some medicines can act on the nervous system or the bladder, influencing the control of urination. Importance of the urinary bladder. The urinary bladder is a vital organ for the urinary system, allowing the body to store and eliminate urine efficiently. Bladder dysfunction can lead to problems such as urinary incontinence, urinary retention, and urinary tract infections. To summarize, the urinary bladder is a muscular organ that stores urine until urination. Its structure and function are essential for the proper functioning of the urinary system and the general health of the body.